What is the mechanism of manifestation of Sannipataja disease? What is the pathological events that may take place in Sannipataja disease? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the Sannipataja disease, that means where there will be the abnormal increase of all the three dosha, that is abnormal vitiation of vata, pitta and kapha that is going to take place in an individual. So that is considered to be the main reason for the manifestation of Sannipataja diseases. What are the possible causes they are being mentioned for the Sannipataja diseases? They are mentioned in Ashtanga Hridaya Nidana Sthana first chapter. मिश्रीभावात् समस्तानां सन्निपातस्तथा पुनः सङ्कीर्णाजीर्णविषम विरुद्धाध्यशनादिभिः व्यापन्नमद्यपानीये शुष्कशाकाममूलकैः पिण्याकमृद्यवसुरा पूतिशुष्ककृशामिषैः दोषत्रयकरैः तैस्तैस्तथान्न परिवर्तनात् ऋतोर्दुष्टात् पुरोवातात् ग्रहावेशात् विषाद्करात् दुष्टान्नात् पर्वताश्लेषात् ग्रहेर्जन्मनक्षत्रपीडनात् मिथ्यायोगात् च विविधात् पापानां च निषेवणात् स्त्रीणां प्रसववैषम्यात् तथा मिथ्योपचारतः. These are the possible causes they are being mentioned for the manifestation of Sannipataja diseases. Of course, its interpretation will be dealt in some other video. As this, if you are going to have the interpretation of each and every in this particular video, the length of the video will be much longer and the purpose of this particular video may not serve. Hence, this will be dealt in some other video. As far as the Sannipataja disease are concerned, each and of course, the interpretation is very difficult. Still, based on the different parameters, as we have discussed in the previously regarding the Ekadoshaja Vikara and Dvandoja Vikara, we have taken the same pattern to analyze this Sannipataja disease manifestation also. Based on the Panchabhuta point of view, Panchamahabhuta point of view, the people who are indulging in the Nidana, they are responsible for the increase of all the five Mahabhuta in an individual. Thereby, that may be responsible for the Sannipataja Prakopa there. When you think about all these five Mahabhuta substances, they are going to be taken by equal proportions. Each of these, they will be having a 20% of the increase there. But this is not the case usually. In some of the occasions, Prithvi may be 30%, Up may be 10%, Tejas may be 20%, Vayu may be 30%, Akasha may be 10%. In that way, in some other occasions, Prithvi may be 40%, Up may be 0%, Tejas may be 20%, Vayu may be 0%, Akasha may be 10%. So in that way, so depending upon the Nidana as such, each and every Nidana, so that will be having the different degree of vitiation of the or abnormal increase of the Mahabhuta there. Depending upon that, we are going to have the increase of the Sannipataja or all the three dosha depending upon that. Its impact may be seen in any part of the body, may be seen in the alimentary canal, or it may be seen in the intravascular compartment, or it may be seen in the interstitial compartment, or it may be seen in the intracellular compartment. But accurate analysis requires a deep understanding of the subject based on the Shadrasa point of view. If the person is going to consume this much amount of the food at a particular time, so which may be consisting of all six rasa itself, wherein the person may be developing the abnormal increase of all the three dosha, vata, pitta as well as kapha dosha. As such, if you are considering the rasa, its impact is specifically seen in the oral cavity and in the surroundings. Of course, the dosha prakopa may occur. Which particular rasa is being taken first? Is it madhura rasa, or is it katu rasa, or is it amla rasa, etc., etc.? So that will be deciding the initiating the disease manifesting dosha there. And depending upon the nature of appetite, sometimes the person may be having the poor appetite, sometimes the person may be having the very good appetite or astonishing appetite, etc. Depending upon that, the person may be consuming the food substances. Based on that, the person may be having the clinical manifestation, specifically in terms of Sannipataja Vikara. Sannipataja Vikara, all the six rasas that will be taken in abnormal increased quantity. Thereby, the person may be getting the Sannipataja diseases as such. Then, regarding the guna point of view, it is being mentioned that Vata dosha is having the Tatra dosha Raghushita Karasukshmaschala Vanilaha. Pitta dosha, Pittam Sasnehatikshnoshu Raghuisram Saram Dravam. When you think about the Kapha dosha, Snigdoshito Gurur Mandash Lakshno Mritsna Stiraha Kafaha. So, in that particular sense, if the person is going to consume the substances which are having these three, the gunas increase, which may increase the all the three dosha in the body, which may lead to the increase of the Sannipataja dosha in the body. Of course, the amount of the exposure to these nidana, it has to be analyzed individually. For example, the coldness. When think about the coldness, there may be the possibility of exposure of this particular coldness into the nose or into the eyes, ears or mouth. Suppose if the person is going to consume the cold, ice cold water, then the coldness may be exposed to the oral cavity. If the person is consuming the, what do you say, that the residing in the AC room, then the coldness may be exposed to the nose, eyes, ears, etc. In that way, the amount of the exposure of nidana, that individually that has to be analyzed. Based on that, we are going to say that there may be a possibility of the Sannipataja dosha prakopa. When you think about the consumption of sweets, so in that the sugar that may be varying, the concentration of sugar. In case of the lassi, that may vary. In case of gulab jamun, that may vary. In case of ice creams, that may vary. Depending upon that, we are going to expect the increase of the kapha dosha there. And if the ice cream is having the, what do you say, that the faluda, etc., then we are going to expect the increase of the pitta as well as vata also. In that way, the nature of the guna, depending upon the exposure of these guna, proportion of the guna, so that may lead to the manifestation of the Sannipataja Vikara. So here, for example, let us say snigdhatva exposure. Suppose if the person is going to consume snigdha ahara as such, then we are going to have the increase of the snigdhatva in the alimentary canal. Thereby, we are going to expect the increase of the pitta and kapha dosha there. Abhyanga with the oil, then increase of the snigdhata may be seen in the skin. If the person is having the Ushnavirya Dravya oil application with Abhyanga, then there may be a possibility of increase of the pitta there. Nasya, increase of the snigdhata that may be observed in nose and other surrounding structures. Anuvasana basti, increase of the snigdhata will be observed in the large intestine. Snehapana, increase of the snigdhata that may be seen in the upper and lower alimentary canal. Applying the oil to the natural orifices That means increase of the snigdhata that may be seen in these different natural orifices. Regarding the content of the oil, we are going to expect the increase of the either pitta or vata or kapha dosha in the body. In that way, we are going to see the impact of this snigdhata regarding the vipaka point of view. If the person is going to have the exposure of the substances which are having katu, amla and madhura vipaka, then there may be a possibility of the abnormal vitiation of vata, pitta as well as kapha dosha that is going to take place. But here, the impact will be seen in the alimentary canal. That too, that may be seen in the small and large intestine. Based on the virya point of view, if the person is going to consume the substances having the shita and ushna virya, then we are going to expect the abnormal vitiation with sannipata dosha. Thereby, the person may be having the sannipataja disease manifestation. As the virya that is having the impact on any part of the body, thereby the abnormal increase of these either vata, pitta and kapha that may take place either in the alimentary canal or that may be seen in the intravascular compartment, or it may be seen in the interstitial compartment, or it may be seen in the intracellular compartment. As far as the prakopa karma point of view, we have to know about the each and every lakshana of the prakopa karma. So that is been mentioned that Sramsavyasa Vedaswapa Sadaruktoda Vedanam Sanganga Bhanga Sankocha Varta Harshana Tarshanam Kampa Parshya Saushirya Shosha Spandana Veshtanam Stambah Kashaya Rasata Varna Shavu Aruno Viva Karmani Vayoho Pittasya Daharagoshma Pakitaha Svedah Kledah Srutih Kota Sadanam Murchanam Madaha Katukamla Varso Varna Panduraruna Varjitaha श्लेष्मणः स्नेहकाठिन्यकण्डूषितत्वगौरवं बन्धोपलेपस्तैमित्य शोभापत्यति निद्रताः वर्णः श्वेतो रसौ स्वादु लवणौ चिरकारिता. These are the descriptions available in the context of Prakopa Karma that is being mentioned in Ashtanga Hridaya. We have to analyze them in the patient. Here is an image wherein the person is having the when you compare the other limb, so here we are going to see the huge swelling that is indicative of shofata, which may indicate the kapha dosha increase. And when you compare the other limb, so this particular limb is having the redness, which is indicative of ragata, which may suggest the person is having the pitta dosha prakopa there. And of course, this will be associated with the toda or pricking type of pain, which is not perceivable by the objective science. It is perceivable by subjective science only. Hence, toda that can be observed here, it may indicate vata dosha prakopa there. In that way, we have to analyze each and every prakopa karma in the individual to analyze this based on the clinical features point of view. So here an image which is indicative of 25 years old male presented with cough with whitish sputum for the first 5 days, followed by yellowish colored sputum, which is indicative of the initially the kapha dosha vitiation. This is followed by the pitta dosha vitiation, then reddish colored sputum, which is indicative of the presence of the rakta there. So thereby we are going to say that there may be a possibility of the Sannipata dosha prakopa. So which is indicative of the rapidity of the onset of the clinical manifestation in terms of the dosha vitiation. Based on the sthan, we have to inquire about the lakshanas of each of these sthana of the dosha. It is being mentioned pakvashaya kati sakti shrotrasti sparshanendriyam sthanam vatasya tatrapi pakvadhanam visheshatah नाभिरामाशयो स्वेदो लसिका रुधिरं रसः दृक् स्पर्शनं च पित्तस्य नाभिरत्र विशेषतः उरः शिरः क्लोम पर्वाण्यामाशयो रसः मेदो घ्राणं च जिह्वा च कफस्य सुतरामुरः. We have to inquire regarding the dysfunctions of each of these specific organ dysfunction. For example, pakvashaya. whether the person is having the bloating sensation of the abdomen, or whether the person is having the constipation, or whether the person is having the diarrhea, or whether the person is having the discharge of the pus via the anus or the surrounding structures, etc. That has to be inquired. We have to inquire about the abnormal increase of Vruddha and Kshaya of Vata, Pitta and Kapha dosha. It has been mentioned that वृद्धस्तु कुरुते निलः कार्श्य कार्ष्णोष्ण कामित्व कंपानाः शक्रग्रहान् बलनिद्रेन्द्रिय भ्रंश प्रलाप भ्रमदीनता लिंगं क्षीणे निलयंगस्य सादोल्भं भाषिते तं संज्ञामोहस्तथाश्निभ वृद्धिक्तामय संभवः. So each and every lakshana has to be inquired. Similarly with that of the pitta and kapha dosha, we have to inquire about the prakopa of the vata, pitta, kapha. That has to be inquired in these different sthana. Then only we can able to analyze the Sannipata dosha prakopa in terms of the sthana point of view. As far as Udbhava sthana point of view, depending upon the manifestation of the first symptom, we are going to observe the dysfunction of either Urdhva Amashaya or Amashaya, that is Adho Amashaya or Pakvashaya. So we have to see about the chronology of the symptoms. Based on that, we can able to determine the Udbhavasthana of the disease, specifically in case of Sannipataja Vikara. Regarding the Balasamprapti point of view. So here, an image is being shown wherein the person is going to consume large amount of the food in a single individual. In that particular situation, if this particular food is being consumed for one day, then Tridosha Prakopa may take place milder. If this particular substance food is being taken for continuously 3 days, then we are going to observe the moderate dosha prakopa. If this is being continuously consumed twice for 3 days as such, then we are going to observe the much more severe dosha prakopa, that to Sannipata dosha prakopa in that particular situation. That means the dosha prakopa is actually a relative term. That means we have to see one particular from one particular angle. We have to see whether is it increased or decreased. Based on that, we can able to say the degree of the severity of the nidana as such. As far as lakshana are concerned, we have to know about the each and every lakshana of vata, pitta and kapha there. वृद्धस्तु कुरुते नील कार्श्य कार्ष्णोष्ण कामित्व कंपाना शकृद्ग्रहान् बलनिद्रेन्द्रिय भ्रंश प्रलाप भ्रमदीनता, which may indicate vata dosha increase, pita vinmutra netratva kshutra dah panidratah pittam, which may indicate pitta dosha increase, श्लेष्माग्नि सदन प्रसे कालस्य गौरवं श्वैत्य शैत्य शतांगत्वं श्वास कासाति निद्रता, which may indicate kapha dosha increase in the body. Depending upon the degree of the Sannipata dosha prakopa, the person may be observed will be having the more than these lakshana, which may indicate the increase of the each of these dosha in the body. As far as Nidana point of view, so we have to know about the source of the entry of the pathogen, number of the pathogens entering into the body, and virulence of the pathogens entering into the body. So when you think about this particular example, the source of the entry of the pathogen is through the oral cavity. Number of the pathogens, when you consider, it is considered to be number of pathogens are more because amount of the food is more. That means the number of pathogens that may enter into the body, that may be more here. And virulence of the pathogens. Suppose if the particular the plate is consuming is having the 3 curds as such instead of 1, then it may indicate virulence of the pathogen that may be more, specifically in relation to the curds as such, which may indicate the abnormal increase of the kapha dosha that is going to take place there. So like that, what is the ingredient of the food substances? What is the ingredient of the nidana that is going to get exposed by the human being? That is going to decide the manifestation of the Sannipataja vikara. To sum up, the Vata, Pitta, Kapha dominant diseases, what we can say, Sannipataja diseases, we have to inquire about the Nidana, which will be increasing the Akasha, Vayu, Teja, Up and Prithvi Mahabhuta in the body. The persons, they will be having the exposure to excess consumption of all six rasa, that is Madhura, Amla, Lavana, Katu, Tikta and Kasha. The exposure to Nidana, which increase Shita, Ruksha, Tikshna, etc., which are indicative of the abnormal increase of all the Tridosha the vitiation that will be observed there. Exposure to Nidana, which have the Shita and Ushna Virya, and the persons who are having the excess consumption of the substances which are having the Madhura, Amla and Katu Vipaka, there may be the Tridosha Prakopa may be seen. As far as Lakshana are concerned, Sramsa Vyasa Vyathaswapa Sadaruktoda Bhedanam, Sanganga Bhanga Sankocha Varta Harshana Tarshanam, Kampa Parushya Saushirya Shosha Spandana Veshtanam, Tambah Kashaya Rasada Varna Shagu Arnopiva Karmani Vayoho, Pittasya Daha Ragushma Pakitaha Sveda Kleda Srute Kota Sadanam Murchanam Madaha. कटुकाम्लवरसौ वर्णः पाण्डुरारणवर्जितः श्लेष्मणः स्नेहकाठिन्ये कण्डूषितत्वगौरवं बन्धोपलेपस्तैमित्य शोफापक्तिति निद्रताः वर्णः श्वेतो रसो स्वादु लवणौ चिरकारिता, which may indicate abnormal increase of the all three dosha. As far as the Lakshana is concerned, then वृद्धस्तु कुरुतेन कार्श्यकाष्णोष्ण कामित्व कंपानाश कृद्ग्रहान् बलनिद्रेन्द्रिय भ्रंश प्रलाप भ्रमदीनता पीद विन्मूत्र नेत्रत्व क्षित्रोद्दाहल्प निद्रताः पित्तम् श्लेष्माग्निसदप्से कालस्य गौरवं श्वैत्य शैत्यष्टांगत्वं श्वासकासाति निद्रता. We are going to observe the multiple lakshanas based on the Udbhavasthana. As such, there may be a possibility of either Pakvashaya or Adho Amashaya or Urdhva Amashaya. Many affliction may be observed depending upon the chronology of the symptoms. We have to observe the dysfunctions of the locations of each of these Vata, Pitta and Kapha. Pakvashaya Kati Sakti Shrotrath Sparshanendriyam Sthanam Vatasya Tatrapi Pakvadhanam Visheshatah Nabhiramashayu Svedo Lechika Rudiram Rasah Drik Sparshanam Cha Pittasya Nabhiratra Visheshatah Urahakanta Shiraha Kloma Parvanyamashayursa Vedo Khanam Jilpa Chakapasya Sutaramura. We have to analyze the samprapti of Vata, Pitta and Kapha. Individually has to be analyzed, and we have to carefully analyze the Nidana of each of these Vata, Pitta and Kapha. व्यायामात् अपतर्पणात् प्रपतनात् भंगात् क्षयात् जागरात् वेगानां च विधारणात् अतिशुचः शैत्यादतित्रासतः रुक्षक्षोभकषाय तिक्तकटुकैरेभिः प्रकोपं रजयतु आयुर्वारिधरागमे परिणते चान्यपरान्ये अपि च, which may indicate Vatadosha vitiation. कट्वं नोषु विदाहितिष्ण लवणक्रोधोपवासा तपस्त्री सम्पर्कतिलातसि दधिसुराशुक्तारणानादिभिः भुक्ते जिरेते भोजने च शरदि ग्रीष्मे स्थिति प्राणिनां मध्याह्ने तथा अर्धरात्रिसमये पित्तं प्रकोपं व्रजे, which may indicate Pittadosha vitiation. गुरुमधुर साधस्निग्ध दुग्धेक्षवक्ष द्रवदति दिननिद्रावुपसर्पिष्परपूरैः दुहिनपतनकाले श्लेष्मणः सम्प्रकोपः प्रभवति दिवसादौ भुक्तमात्रे वसन्ते, which may indicate kapha dosha increase in the body. Dear ANA community, that's all for today. What are the major key takeaways of today's discussion? Mention in the comment box below. What is the one video you'd like to see in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of True Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.